Starting a men's health company comes down to 7 high-level steps. Choose your care model, define your niche and audience, map your care journey, build your legal and clinical compliance foundation, set up your digital infrastructure, staff your clinical team, and determine your pricing model and go-to-market. Let's walk through each one. Step 1. Choose your care model. You have 3 paths. A virtual care model can be the fastest path to launch, lower in cost, and it reaches patients across every state you're licensed in. An in-person clinic builds local credibility and lets you offer on-site labs and injections, though it carries higher overhead and is limited to your geographic location. A hybrid model blends the two, pairing virtual convenience with in-person trust, and is often the most flexible, but it requires more coordination across both. Pick the model that best fits your budget, your market, and how fast you want to launch. Step 2. Define your niche and audience. The strongest men's health brands speak to a specific male audience, not to everyone. Get clear on who you serve, what they're struggling with, and the outcomes that matter most to them. Then choose 1 or 2 core service lines to launch with, whether that's hormone and testosterone support, medically supervised weight management, hair restoration, sexual health, or longevity and performance. Launching with a focused scope helps you build credibility and stay compliant before you expand. Step 3. Map your care journey. A strong men's health program follows a clear clinical path. Start with screening, using symptoms and lab work to confirm eligibility for safe prescribing. Build evidence-based care plans that combine medical therapy with lifestyle guidance. Schedule regular follow-ups and lab reviews to track progress. And use plain language education and consent before any therapy begins. Step 4. Build your legal and clinical compliance foundation. This is where men's health companies establish a strong infrastructure foundation for long-term success. Register your business entity and put medical director and supervision agreements in place where required. Confirm your clinicians are licensed in every state where they treat patients, and use HIPAA-compliant systems to protect patient information. Because testosterone therapy is a controlled substance, make sure your prescribing follows DEA requirements, applicable telehealth regulations, and state laws. Finally, review your website and marketing materials to ensure they comply with FTC requirements and applicable healthcare advertising rules. Step 5. Set up your tech stack. Your technology decides how well you can scale while staying compliant. You'll want a HIPAA-compliant telehealth platform for video and asynchronous visits, an EHR that manages labs and prescriptions, online intake and scheduling, secure messaging with refill reminders, and direct integrations with licensed pharmacies and labs for e-prescribing. Step 6. Staff and credential your clinical team. For a men's health program offering, you will typically need physicians or DOs. In some states, nurse practitioners can prescribe testosterone under a collaborative practice agreement. Because testosterone is Schedule III, every prescribing clinician needs an active DEA registration. Each clinician also needs to be licensed in every state where your patients are located. Ensure credentialing covers license verification, an NPDB check, malpractice coverage, and confirming DEA registration is current. Then standardize your protocols so every patient gets a consistent experience, with clear escalation paths for anything outside routine care. Step 7. Determine your pricing model and plan your go-to-market. Most men's health companies may use one of 3 pricing models. Cash pay is simpler and fast to launch. A membership or subscription model supports ongoing, connected care. And a hybrid or insurance model broadens access, though billing gets more complex. From there, build your go-to-market plan around the channels that reach your patients. Lead with education and patient outcomes, and let real results build trust. That's the high-level view for starting a men's health company. If you're not ready to build from scratch, OpenLoop provides the clinically compliant, white-labeled infrastructure operations to launch faster, with a 50-state clinician network, built-in EHR, scheduling and messaging, and DEA and telehealth prescribing support. Build your men's health brand in just days with OpenLoop. Visit openloophealth.com to learn more.